Here we go. Dr. Melnick, there's, people do implants, and you do implants obviously, and you're obviously an expert at that stuff with all your training, you and Dr. Miles. Lately we hear a lot about instant implants, one-day implants. Walk in, 3 hours later, walk out with everything done. Is that a good thing? Is that a bad thing? Does that fit for everybody? Tell us about it. I'm sure you know all about it when there is the need for it. But because you hear it advertised a lot. Come in and walk out with a full implant. Don't need to wait 3, 4, 5 months. Why would anybody still wait 3 or 4, 5 months if you don't have to? So there must be a clinical and technical reason for it. Tell us about it.
Well, that's an interesting question, Helmut. Let me give a little background before I get right to the chase, because it's kind of a complex issue.
Okay.
You know, implants have been around for a long time. Successful implants have been around for a shorter period of time.
Okay.
Back in 1980, there was a meeting of the leading implantologists in the world up in Toronto, and at that point, the modern implant era was born. The criteria for implant success was defined. And one of the key issues was when we placed an implant, we didn't load it right away, meaning we didn't put a tooth on it right away.
Okay.
In order for an implant to be successful, when you place it in the jawbone, you're drilling into the jawbone and then screwing the implant in. There is space between the edge of the bone and the implant. Over time, new bone growth fills in between the edge of the prepared bone and the implant. And the new bone actually attaches to the implant. We call that osseointegration. In other words, that implant is as solid as a rock. The problem is that if you load the implant too soon, and the implant is shaking in the bone, you don't get new bone growth. You get soft tissue growth called connective tissue, and ultimately the implant will fail. However, we live in a society where people want everything yesterday. So over time, techniques have improved, and there are some instances where implants can be placed and a tooth can be put on it, but the tooth may be slightly undersized, and it's thinner in the back. So if we're talking, for example, somebody's upper front tooth, they won't want the implant in a tooth right away. That tooth may look like it's fully there, but it's not fully functioning there. It's undersized. You can do that.
Undersized so it doesn't get the pressure of the rest of the food. When you bite in,
when you're biting down, the crown attached to the implant is not touching the opposing teeth.
Mm-hmm.
You still have the risk that a person's tongue can press on it and cause the implant to fail. Me personally, I personally don't like to do single tooth immediately loaded implants. However, if you have several implants that span the whole arch, in other words, let's say you place 6 implants on the lower arch, and it's properly planned using the modern X-ray technology where surgical guide stents are made and the restoration that you're attaching is made ahead of time. When you have multiple implants placed and the teeth connected to each other, that's called cross-arch stabilization. And that basically allows each of the individual implants to protect the other implants against chewing forces. Studies show that when you do that type of restoration involving multiple implants under very strongly planned surgery, that is a successful way to do immediate implants.
I see.
But individual implants, I think you have to ask yourself what Clint Eastwood said in the movie, are you feeling lucky? Not saying it can't be done,
right,
but you're increasing the risk of potential failure.
Well, it looks like, you build anything, you keep telling that the foundation needs to be good. So when you pour a foundation for a house, you let it dry out, you see whether a couple cracks, develop, you fix those couple cracks, maybe if they do, and then you build the rest of it. You don't just start building right away. It's
the modern implant systems today, when you adequately allow the implant to be fully fused to the bone, allows for an over 90% success rate. I'm just not willing to risk a lower healing percentage because someone's in a rush. There are other ways to make temporary teeth that will allow patients to walk around without being embarrassed and still allow the implants to heal.
I get that, and I'm very sure your patients appreciate that factor after they have done it. While they do it, they might bitch a little bit, but once it's done and it's beautiful and it's gorgeous and years and years later it's still there and just as functionable, they will say, I'm glad I followed his advice.
Well, the other thing to consider is if the implant is not successful, not only will the implant fall out, but now you're left with the task of trying to rebuild the lost bone.
Right.
And that's going to enormously delay the final implant success.
Right. Yeah. No, absolutely. Yeah, absolutely. I can see that why. So anyway, let's do it right the first way. So, there is here and there a reason why this can be done, but on an average, you think that this instant implant thing is a little bit hasty and might ask for problems down the road. And why do that with health? No reason to. Mm-hmm. Thanks a lot, Dr. Melnick.